afternoon, everyone, and welcome to one more empowering edition of the Vibe Life, a Hexalog. The Vibe that stands for Women Inspire, Build, and Enhance is a platform dedicated to fostering women's excellence. It brings together women doctors from various fields to share knowledge, leadership experiences, and personal journeys that inspire growth as well as collaboration. There are practically four fundamental pillars that form this vibe, which are physical well being, mental health, financial wisdom, and the professional excellence, of course. Through various initiatives, the vibe strives to build a strong community of women professionals who uplift one another and redefine the landscape of healthcare leadership. I'm Dr. Ritu Johari, consultant diabetologist and metabolic expert practicing in western suburbs of Mumbai. With a unique diverse background, last decade and a half spent in pharma industry and last half a decade in the clinical field, I practice diabetes, thyroid, and obesity. Besides my clinical practice, I also have a medical writing agency, which is RFECT, and I contribute to it. And also, what brings me most pleasure in sharing is the introduction of this exclusive initiative, The Vibe, a platform which is one of its kind and with my favorite women in the world. I'm indeed blessed to be complimented by my husband, who's an orthopedic surgeon, and our family feels complete with a teen son and a toddler daughter. With that, let me introduce you to our team vibe. Dr. Lutika.
Hello, good afternoon, madam. Welcome today to our platform. I'm Dr. Lotika Purohit, a diabetologist and a lifestyle medicine physician practicing in Kolaba, Mumbai since the last 3 decades. I'm also the visiting faculty at the JJ Group of Hospitals and the Grant Government Medical College. Besides that, I'm an avid Rotarian. I've been the president of my Rotary Club. And this year, I'm also involved in the lifestyle diseases initiatives. What gives me a lot of happiness in the last few weeks has been the highlight of my week is this Wednesday afternoon hexalog, which we have, wherein five of us sit with a star speaker like yourself, and we discuss what are the challenges that she has faced in her journey, and we share experiences and thoughts just to for us to grow as well as for the other women physicians who are watching to grow. So now I hand over to Dr. Pranjali for her introduction.
Thank you, Lotika. Good afternoon, everyone. Good afternoon, ma'am. I'm Dr. Pranjali Shah, Director and Chief Diabetologist at APT Diabetes Clinic, Mulund, Mumbai. I love treating young diabetic patients, help them live longer and stronger. Also, I believe awareness is it's the root cause where you can actually prevent a lot of metabolic diseases and disorders. So we do a lot of community awareness camps in the society and the rural Maharashtras. But if you don't find me in my clinic, you will see me doing farming on weekends, playing hiking, playing with my boys, and helping in the animal shelters, and spending quality time with the people around, in the societies. Also, I love connecting with leaders like you and participating such communications on every Wednesdays, ma'am. Over to you, Dr. Kavita.
Thank you, Dr. Pranjali. Hello, everyone. Good afternoon, Doctor. I'm Dr. Kavita Rane. I have been a cardio-diabetes expert practicing in Chembur at Rani Hospital. I'm also the Director of Operations at the hospital. I also practice at Apollo Spectra in Lax General Charitable Hospital. So we have been running a cath lab. Me and my father do that in Chembur at Rani Hospital. I have learned a lot through inpatient department being diabetes. And along with that, what I love to do is I love painting and sketching. I love to draw. I love EDM music, and I love to play golf. And this Vibe Live every Wednesday has been a game changer in my life. I have learned so much from all the speakers who come on this platform and also from my seniors right here. So thank you very much, and over to Dr. Rukia.
Hello, ma'am. I'm the last fifth to make it complete hexalog. I'm Dr. Rukia Surya Sheikh. I'm a diabetes, thyroid, and obesity specialist I've been practicing in Mulund for the past 15 years. And over these years, I've had the privilege of walking alongside my patients through their health journeys. And when I'm not consulting, you'll probably find me working out, playing carom, or just laughing over good conversations and great company. I believe wellness isn't just about numbers and hormones. It's about balance, the connection, and the joy that you bring to your patient. So I'm really looking forward to today's session, not just to share, but what I know, but to learn, to exchange, and to grow together as women in medicine. Thank you so much for coming.
Sure. Thank you. Am I audible?
Yes, ma'am, you're
Yeah,
audible. A very warm welcome to you, ma'am. Please give me the honor of introducing you. We are truly, truly privileged that you agreed to be on our platform. So, a quick question, ma'am. How did you feel when you were invited for the Vibe Live?
Truly speaking, I am awestruck by the whole concept of Vibe and the Hexalog. Very intriguing, very creative and innovative, I should say. And it's commendable that a group of accomplished women who have hectic practice, but also look after and give back to the society, have got together to showcase other women, pioneers in respective fields. It's so much in sync with the current International Women's Day theme, which is Give to Gain, and you're already doing it. Maybe you inspired the theme for the International Women's Day, and kudos for that. This is amazing. And that's a very lifestyle medicine concept. So give to gain. The more we give to the environment, the more we give to the society, the more we can gain good stuff. It pretty much becomes karmic theory, but nevertheless, lifestyle medicine teaches us with regards to positive psychology as well. The more you're awed, the more you're inspired, the more you're grateful, the more to gain. And you're already doing it, and you're already trailblazers for the current International Women's Day theme. And kudos, and I am really honored that I am sharing the same platform as yourself.
Thank you so much, ma'am. Those positive words are truly so motivating, and we're so happy that this sisterhood, also involves you for us, and you truly inspire women like us. So clearly, for the audience, we are truly happy that we could host Dr. Meera Raghavan, a distinguished academician, clinician, surgeon, researcher, and a global icon who has inspired one of many young women to pursue excellence in their passionate streams. Pelvic disorders particularly affect 25 to 75% of women in India. I'm sure ma'am would give us more details on that. And of course, here is an expert woman leader who's been managing urogenital problems with expertise in robotic solutions. So, welcome to a Hexalog with Dr. Meera Raghavan. Quickly, few words about her. Madam works as senior consultant urogynecologist and robotic surgeon. She's a proctor and trainer on the Hugo RAS robotic platform. She's the convener at the TN4 certificate course in urogynecology. She's board certified lifestyle medicine physician as well. She's the treasurer of the SOVSI or SOVSIT Tamil Nadu chapter. She's the core committee member for the Urogynecology Committee FOXI since 2015. She's also the scientific chair for the AICC RCOG 2025. She's the national board coordinator and examiner for the MRCOG trainer and examiner as well. She's the director of the ASCOT at the Apollo Stimulation Center, and she has been a gold medal expert. She's had 32 gold medals, yes, you heard me right, during her UG, and has been the best outgoing resident at the PG JIPMER at Chandigarh. So with that, welcome ma'am to this wonderful platform, and over to you, Dr. Lotika, for the first segment.
Wow, it's really a nice and an honor to have you, madam. So let us start with the first segment. First segment is usually about the calling, the choosing the surgery and choosing the precision. So from scalpel to the console. We all know that surgery is very demanding, and especially for women, and urogynecology is even more so. So what drew you to this specialty, and what has sustained your passion all through these years?
Very interesting question that I chose obs-gynae. It wasn't my first choice, let me put it very straight here. When I was an intern, because I was very a meritorious student from the start and very driven, I always wanted to do internal medicine and super specialized to do endocrine, to be honest.
Okay.
And I was an intern with my internal medicine prof, who had written a very famous textbook, which is followed by most of the undergraduate medical students. He called me aside one day and said, I don't think you should take up internal medicine. I sincerely urge you to take up obs-gynae, because obs-gynae is a holistic approach to women's health. It's not just about delivering babies. You treat them for generations. You treat them in a preventive manner. You treat them holistically, and you can contribute both your clinical as well as surgical skills to the cause of women. And if women don't do that, who else will do? And that kind of struck a strong note inside me. And at the last minute in my counseling, I took obs-gynae, which I do not regret for one single moment. I still call up my prof on his birthdays, and I do tell him, and he still remembers that conversation we've had. It's come a long way from that point. And I used to love hardcore obstetrics because I trained in PGI, which is extremely busy, and subsequently in the UK. But what I started seeing is as we deliver more and more, women are subjected to a lot of birth trauma, and that leaves them with a lot of pelvic floor dysfunction, which is kind of under-recognized, under-emphasized, and just brushed under the carpet most of the time, because a success of a woman's pregnancy is unfortunately notified or qualified by the mode of delivery. I think at the outset, we should do away with it. A well mom and a well baby should be the outcome, not a completely shattered pelvic floor, a mother completely incapacitated, poor dignity, poor quality of life, but a healthy baby by vaginal delivery. That should not be the goal of any practice of obstetric in the future. So this prompted me to take up incontinence as a kind of specialization. And thankfully, we started having structured programs for Urogynae in the UK. And I used to run the pelvic floor repair workshops in Manchester Deanery. And when I relocated back, I continued to go on with the specialty. With increasing survival and longevity of women now, we see more and more coming through the door with this unspoken, unrecognized, unacknowledged problem. And they find it very shy, very inhibited even to talk with their own spouse or children. So I thought, why not spearhead the cause for women like you people have already set up Vibe for women around us. Yes.
Yeah,
That
this
is
is so nice. This is really so inspiring for all of us. Madam, and we all know that robotic surgery has entered a few years ago, and especially in your field. What made you embrace the technology rather, a lot of people say, okay, let's see how it is and thereafter embrace it. But you have taken it on head on, and you have kind of used it a lot. So what made you embrace robotic surgery?
Yeah. Just like AI, which is kind of upon us to prevail and be there for future, I think it will not replace us, but if we don't keep abreast, people who have embraced it will replace us. Similarly, robotic platform started in India somewhere around 2013, and that was the time I had relocated back to India after a 15-year stint in the UK and as consultant there. And there are definite urogynecological surgeries which are extremely skill intense, if I may say so, and which also get complicated even further by a rising BMI of the patients, their comorbidities, multiple surgeries, and so on and so forth. So getting access to deeper pelvis, working around very precisely the ureter, the bladder, and the rectum needed a lot of precision, magnification, as well as kind of a 3D perception. And that was available with the robotic platform. So to clarify to everyone, robotic surgery is just an interface platform between me and the patient. I cannot call myself a robotic surgeon because I'll be then calling myself as I've been once a scalpel surgeon, then I've been a laparoscopic surgeon, and then a robotic surgeon. So we don't find it fanciful in terming ourselves by the technique. It is the surgeon who uses the robot as the tool to accomplish the task. Previously, we used the dial phone, then we went on to mobile, then we use iPad and similar stuff. But we do not just call ourselves so. So similarly, this is just an interface between me and the patient. I am the master. It is still my slave. It cannot do things of its own. It has to still obey me. So, so that is what robotic surgery is about. And it beautifully lent itself as a platform to enable me to do surgeries which otherwise would have to be a long open incision with multiple comorbidities, complications, at least a week or 10 days stay for the patient in the hospital, and escalating costs associated. Of course, needless to say, the wound complications and the chest-related complications. Say, for example, a fistula between the bladder and the vagina, where the patient is constantly leaking urine. I do this robotic surgery with minimal access. Patient goes home the next day. That is the beauty of this platform, especially for my specialty, which is why I embrace this straight on.
No, it's very interesting. Could you share any case wherein, though I know you've said that how you could use it, but any case which was a defining moment for you that this is the future of for the pelvic health?
Absolutely. I can quote one from early on in my robotic career. I did take 20 to 25 cases for my learning curve, which is actually much affordable and doable for anybody aspiring to be a robotic surgeon in the current era. It's like playing a video game, and the more simulation exercises you practice, like stacking up rings, stretching rubber bands inside the console, or threading and needling and trying to suture gel pads. It's fun, believe me. You feel like a teenager doing your video games, and the more you play on it, the more adept you get at the console, even in the depths of the pelvis. So one defining moment for me was earlier on, I would say 2014, 2015, there was this lady from Northeast who had a very young girl of 21 who had a previous a cesarean section, and subsequently did not get to hospital in time because of the long distance and the monsoon and whatnot. And because we know how the terrain can be in Assam, she took quite a long time, unfortunately had to deliver at home. and because of that had rupture of the uterus, a stillborn baby, and the obstructed labor caused a fistula between the bladder and the vagina, a big one, and continuously leaking urine.
Oh my. Mm.
And her husband abandoned her because of this. So she had come down to seek cure for this problem. It would have been to be, if it was not for the robotic platform, because it's an obstetric fistula. Fistula is an abnormal communication between two tubes where it's supposed to be separate. So urine is continuously leaking through the vagina. It can cause severe ammoniacal dermatitis, severe rashes on the thighs, continuously malodor, and not great quality of life or dignity for a young 21-year-old. She looked as young as my daughter. So, it was disheartening to see in the current era where one place have such interface and technology advancements like robotics, and then in one corner you still have this kind of birth-related trauma happening under your nose. And this lady was taken up for robotic surgery, wonderful reconstruction of the bladder and the vagina, and we interpose fat tissue between the two to create like a compound wall between two rooms so they don't communicate again. So it gives a watertight seal for both, and urine stopped leaking, and she got discharged the next day. We leave in the catheter for a month, take out the catheter after checking the integrity of both of his organs. No leak, take out the catheter, and she's good as gold.
Wow.
So
that's
this kind
amazing.
of really, really was a game changer for me to start believing. First of all, I have to start believing that it's working. So, and then the more you do and keep at it, the better you become. And then I took up on the next platform, which was the Hugo Ras from the original Intuitive Da Vinci. So I operate on multiple platforms and then became a proctor for the platforms as well. So this was a completely quality of life defining moment for me, where I could see the literal translation into what we call dream outcomes.
This is really, really an amazing experience that you're sharing with us. Thank you so much. Now I hand over to Dr. Ruqayyah for the next segment.
Thank you so much. It's been so wonderful. First thing I really want to appreciate, I love your voice. I love it. I don't know if you sing or what, but your voice is so soothing. It's just been so nice hearing you. So, yeah, really.
Thank you. Thank you.
So, ma'am, my segment is about Beyond the Console, the science of robotic excellence, where technology is meeting judgment. So, as you have explained a lot about robotic surgery and, also telling us how it has become better in terms of conventional approaches. So, for the audience who's listening to this and who are unfamiliar about what it is, in short, if you can tell us that, do you really think that robotic surgery truly will enhance the women's pelvic health compared to conventional approaches? Because that's always the dilemma. They go to multiple doctors for multiple opinions. So whether one should go for a conventional approach or no, robotic surgery is a better thing to go.
Absolutely. No, obviously, when we talk surgery, we've exhausted all preventive roles, all medical, conservative lifestyle measures, and then finally end up in a surgical intervention. Right. So for the surgical intervention, definitely robotic is the future, and it's already is the present. Okay. 30 years ago, how laparoscopy came into place, and now you do not see anybody doing unnecessary open surgeries. Similar will be the status, and it is currently already the status for many surgical procedures as far as women health is concerned. Say, for example, uterine cancer. Now the gold standard has become minimal access. We don't open them up because uterine cancer is on the rise. We have a lot more patients coming through with endometrial cancer, which we pick out early because of high incidence of diabetes now and hypertension, high BMI, and exposure to all these endocrine disruptor chemicals, which are exogenously feeding us the wrong type of estrogen into the body and stimulating the lining. So early endometrial cancer, the rule is now the gold standard is to do minimal access surgery, and robotic surgery beautifully lends itself to become the standard already. Most of the urogyne procedures, yes.
Ma'am, any one indication where conventional you could say is better than robotic?
Of course, ovarian cancer, because these are large masses, but even for that, even now. And one thing which can never be replaced is cesarean section. So you cannot replace that for any kind of minimal access. So one thing which can never replace is cesarean section, but most of the others can easily lend itself. Even huge, large uteri, we can take it out through robotic surgery. The beauty is the precision, the magnification, the in-depth perception, the 3D, and it's good for training. Previously, when we were all being trained, when somebody was doing a prolapse, for example, or a bladder surgery from below, all that you can see is heads. Imagine that poor intern or the first year trainee who runs around for blood and this and that, only sees the heads and the scalps of many people, and nothing actually gets translated to observation. So where is the question of see one, do one, learn one? It cannot happen that way anymore. So this is obvious to everybody. And you can teach, you can have a parallel console, excellent platform for training as well, and for auditing your own performance. You review your videos, it's all recorded, it's all there on the cloud. You give the recording to the patient, they can view what has gone on. If there was a complication, I can go back and understand where exactly have I gone wrong. And with AI incorporated into these platforms, it tells of a no-go zone. It'll tell you, don't go there. You have to be here, otherwise you'll injure something. So these kind of advancements are there to ensure patient safety, not surgeon comfort. This is something we need to understand. So enjoy patient safety. And I think surgeon comfort is also important, because a fatigued body and a fatigued mind means poor outcome. And we do not want to let our surgeons become that way. So why not give them that comfort and translate into better outcome for patients? Yes, it is to replace most of the procedures.
Great. So, ma'am, this robotic surgery, as you explained, it requires extreme precision. It has spatial awareness because it tells you the whole 3D image to it. But you also need very calm decision-making skills. So what other skills do you think are most critical when you're operating from the console?
My husband is my mentor. I'll have to proudly say that because he has the maximum number of urological procedures as far as robot is concerned. He's a uro-oncologist. So he proctored me for the first 10 cases, but I had my training separately on the dry lab and the wet lab, and then started doing it. What he always says famously is, you can even teach a monkey to operate. The wisdom which needs to come with is whom not to operate, and when not to jump into something which is technologically advanced. I'll give you an example. Recently, I had a girl who's newly married with multiple fibroids. We just put in a small scope and saw whether it is feasible to do a robotic myomectomy to remove the fibroids. We had done an MRI. The MRI picked up about 14 fibroids. So my onus of responsibility is to make sure I remove all the fibroids completely, reconstruct the uterus with good integrity so she can bear children in the future, avoid the risk of hysterectomy at all costs, and avoid as much as possible blood loss. Of course, we understand it will take a blood transfusion to do that. But so when we put the scope in, just by judging the space around it, the disposition of the uterus, I decided I will do an open myomectomy and not resort to robotic. It's not about my heroism. It's about what is best for the patient. That decision making is crucial as a surgeon. It's not the speed. It's not what you can accomplish. It should not be a situation where operation successful, patient died.
Right.
That is not acceptable at whatsoever cost. So I decided to an open, and I'm so glad. In spite of that, patient got discharged within 48 hours with just a Van and Steel incision. And I removed, guess how many fibroids? 34 fibroids.
Oh.
MRI didn't pick up many of them. 34 fibroids. And
the
an
uterus is
intact
still left
uterus.
after 34.
Beautiful uterus. Beautiful uterus, well intact, not an apple core. And I'm so glad I converted that. I did not even dock the robo. I assessed her and decided to go ahead to an open procedure. That kind of open-mindedness to decide on the spot and consider that is not your failure is very, very important to make these kind of decisions fruitful. So it's not about doing stuff, it's about when not to do stuff.
Absolutely, ma'am. That is so well said that, it is not the robot, it is the clinical judgment of the surgeon behind the robot, which is the most important thing, and which you take the best calls there. And ma'am, even with this bot being there, how do you make sure that, there's empathy? Even with such technological advances, it's not like we put the patient inside, the bot is done, and you go out. There is an empathy factor which is always has to be there, whether it's a physician, a surgeon. So, ma'am, this is so wonderful, the way with which you keep your clinical judgment, and also the empathy that for this patient, it is right for me to do it in open. Wonderful, ma'am. It has been fantastic talking to you. Over to you, Dr. Pranjali, for the next segment.
Thank you, Rukia. So, ma'am, next segment we'll be talking about women's pelvic health and the conversations we avoid. So normally we know that when we are connecting with the patients, many a time patients are reluctant to share their stories, their issues. So so we need to learn from you how we can break the silence around these sensitive issues. So my first question to you, ma'am, we know that pelvic floor disorders, incontinence, prolapses, many women suffer silently. Why do you think these conditions remain unreported?
Because they assume it is normal for them to be like that. I say this very commonly to my women in most of the awareness talks. People assume it's okay to leak after a certain age, just like men bald. I tell them balding in men is age-related, maybe not age-related, it is genetic. But leaking in women, it's not normal. It's not something you can reconcile yourself with. That's how it's going to be. You need to address it. And if it persists for more than 2 weeks, immediately seek help. The earlier you seek help, the better it is amenable to intervention without any invasive procedures. And it is the onus of our practitioners to educate people, make them aware that such a condition is not something to be ignored. And the second point is they do not know whom to go to.
Yes.
That is another thing. And the third thing is if they go to a male doctor, they are not comfortable discussing about that, especially relating to intimate sexual health and these kind of issues, because it's very embarrassing. There are women who've told me they've never disclosed to their spouse, and if only they had daughters, they would feel more comfortable, or asking them for diapers and so on, and they are not able to discuss this with their sons. So
Yes.
this is not an uncommon issue. It has got nothing to do with culture, society. I've seen this in the West as well. There are women who come from the valleys. There was an elderly lady once who came up to me. I was a registrar then. She came up to me and said, "Doc, I've suddenly become a man. I've grown a penis." I said, "Why do you say so?" She said, "Yes, I am for sure something has happened to me. I'll become a man." And then I examine, it's a dangling prolapse of the uterus and the bladder. So such could be the awareness and the understanding of their own anatomy, because it's culturally a taboo to even explore your own private parts, to know properly about what it is. And people do not engage in sexual activity beyond a certain age. Many people think after the kids are married or gone, flown the nest, you're not supposed to be having any sexual intimacy. And these kind of myths around their own practices are the main reason why people don't come forward on their own. But it is changing, so there is still hope.
Exactly, ma'am. So in fact, we see a lot of diabetic women, they are suffering
Oh
with
yeah,
issues, but they don't come up with the problems. And when we go on discussing, then they will start with something, or if their husband are here, so they will ask them to go out and then they will share with us.
correct.
So, ma'am, how can we, as a physician, how can we create a space for women to discuss and open up, and to come out of their concerns and hesitations?
Absolutely.
For all the
Discreetly ask them.
practitioners, yeah.
Discreetly, you people sometimes are the first point of contact for many of my women, because majority of my referrals are from diabetologists, endocrinologists, orthopedician, geriatric physicians, and general physicians. They are the ones who primarily refer them, because it gets to a certain point when it's so uncomfortable for the women, they do not know what to do. They keep coming back. And most of the families, including educated, even health practitioners, attribute it to urinary tract infection. And they keep dishing out antibiotics on their own, or by a local prescription, or a prescription which is being done for somebody else in the family. And this is not going to make the problem away. So for the benefit of everyone, the urinary incontinence can be precipitated, aggravated, can persist with a UTI, but urinary incontinence will not go away with antibiotic treatment. It needs a separate clinical pathway of evaluation, investigation, and treatment and interventions. So we need to educate our patients. So my suggestion to everyone, even including gynecologists who do not ask this question, we should stop writing bladder bowel NAD. That should go away from our clinical history taking. We should discreetly ask them, are you having good control of urine? Do you feel a strong sense of urge? And do you feel the fear that you'll leak if you did not do it in time, or you reach the washroom in time? Do you have time to get yourself undressed before you leak? Do you leak frequently? And how many times do you need to change your undergarments, your dresses? Do you leak in the night? Do you have bedwetting? Do you have difficulty in emptying the bladder? Do you hold on? And do you have constipation? Do you leak when you sneeze, cough, or laugh, or even when you're sexually intimate, or when you do your exercise? Many of them say, I'm a marathon runner. I do leak, but I wear a pad. So many of them say that. It's not uncommon. I see a lot of fitness enthusiasts who come and they ask whether they're okay to do kettlebell swings or they do jumping jacks, because that kind of brings it on. They should still be doing it, but they look after their pelvic floor as well. So it's up to us to discreetly ask these questions so we do not make them fall through the net and still suffer.
So, ma'am, do you suggest like routinely in our clinical practice we should have certain questionnaires which we can give it to the patient?
Absolutely. There's a very simple questionnaire, which is you can download it, ICIQ short form questionnaire for incontinence. It's just got 5 questions, and you will know whether she needs further treatment or not.
Perfect, ma'am. And so last question, ma'am. What is one misconception about pelvic health you wish women should understand earlier?
Women think public toilets cause UTI, and they hold on forever and forever. And to avoid that kind of problem, they do not drink water. And now that is a perfect cocktail to develop a UTI. So if you dehydrate yourself and you do not visit the washroom in time, your blood is full of concentrated urine, which itself is a medium for bacteria to grow, and you will definitely end up in a UTI. So
Yeah.
that is why travel precipitates UTI, not because you've used one public toilet. So UTI is not contagious. This is a commonest myth or perception many of our women carry, and
Yes,
it has
yes.
to be busted.
A lot of them, they use sprays and all just not to get urinary infection.
Oh, yeah. You can do that. That is avoiding contamination. But
Yes.
overt hygiene also causes UTI. People believe it's a hygiene issue. They keep on using ablution, and they keep all sorts of commercial washers. They make the good bacteria wash away. They make the area even drier. And that's another cocktail for getting another UTI. So too much hygiene is also not good
Good.
for us.
Thank you so much, ma'am, for your answers. And over to you, Dr. Ritu, for the next segment.
Thank you so much, ma'am. And there is so much that, we keep on seeing this that, we can totally relate. And I'm sure that, this is going to be a lot of learning, not only for us, but also for the lovely audience that we have. Because, yes, every friend, every sister, every patient, every senior or junior that we are seeing is somebody who can be having these pelvic floor disorders. But I think it is time that we start speaking and addressing these issues. So with that, of course, I migrate towards one thing that I want to mention is the strength behind the precision. And I love the way you smile, the calm, the smile, yet the confidence, holding a robot. I think that gives me a very good goosebump feeling proud. So my segment talks about leadership, resilience, and being a woman surgeon. So first question, ma'am, being surgery and robotics, exactly like you said, are still perceived as male-dominated spaces. How did you establish credibility and confidence in this particular segment, ma'am?
You're absolutely right. This is something which is very daunting as female surgeons. And believe me, you do not get a kind of a pampering treatment, especially in obs and gynae, because you're one in the crowd.
Yes.
If I was in orthopedics, I'll be pampered, but I am not. So that is the situation. But nevertheless, I think we can quite relate to what women say and what our women colleagues also feel and say. I've had 2 children. I've had maternity leave. We multitask. We need to juggle so many things in our head, still keep calm and smiling in front of your patients, not letting your anxiety, your fallen ill child in the nursery, whom you're already dealing with a lot of guilt complex, time for pickup, time for the run, and yet keep that smile on because you mean well for the patient in front of you, because they are much more in greater agony compared to yourself. And I think a woman understands it more in terms of her working environment as well as her patients. And that enables us to do better at our job and become the best at our job as well. That is the drive and that is the impetus which keeps us craving for that excellence and getting it right all the time. Because one trauma for you, you will remember it forever. I've had a ruptured ectopic, so I relate so much to the pain which can a patient experience. And
Right.
I immediately can figure out what kind of agony she could have been going through at that point.
Mm.
So I think as a woman, it actually gives us a lot of advantage to be in a better position compared to our men colleagues, no disrespect to them, that empathy is our strength and that natural compassion is our strength. And I think that replaces many other qualities to be passionate and successful in whatever we do. And that is what I think most of our lifestyle coaches also preach and practice
Okay.
about being mindful. I think we are mindful as women in general to be practicing these.
Super point, ma'am. And I guess completely agree with you that when it comes to patients and especially women, that segment would want to open up to another woman. And I guess that empathy and you call it
Absolutely. Just like
emotional
what you're doing.
intelligence.
Just like what you're doing.
So I guess absolutely, ma'am. That's again, thank you so much for saying that. I guess yes, the moment we connected with you, I'm sure this is how my other colleagues feel as well. We really feel that this is not the first time we're talking to you, and that's what I
Absolutely.
guess also. That's what also happens with women patients. And in fact, earlier I remember we used to hear that in certain cultures probably or Saudi kind of countries people prefer women physicians or women sonologists, but I guess that's not the case anymore. In fact, even in our country, a lot of times they do go to male counterparts, no doubt, but they will definitely want the first preference would be for a female doctor because they feel more connected. It's again, like you said, no disrespect to our male colleagues. We all have husbands who are doctors, but yes,
Yeah.
it definitely makes a lot of difference when you are a woman because you can connect through the problems. So when you were talking of the pelvic floor disorders, ma'am, I still remember when I went through my first pregnancy and I used to cough and leak and I was like, what is happening with me? But you don't speak out these things. And I remember I went to my gynec and I was crying. I was like, you know what? I never knew this could happen to me. I'm done for life. And then she told me that this is very common. It's not something that you should be surprised about. So I guess we always talk and hear these things have been publicized about the good parts. Nobody talks about these challenges. These are not
Yes.
brought out much in common. So I guess again, like you said, women live with these. They don't even tell their spouses because they feel they will be, judged. There's the stigma that, oh my God, this is what I deal with. They will use the pad, they will use n number of things. But yes, that happens. When we ask them, even in our clinics, when I ask my patients, they're like, that's a part and parcel of my life. I leak every day. It's been for 10 years. And they
Yeah.
don't look at it as a problem that can be solved. So, somewhere, I guess, yes, a lot of work for us to do. So great to have you talking about this, ma'am, and we know now where to go. And also, ma'am, one more thing which I was, gauging when you were talking about the robot. And I really love that fact when you say that even though it's a tool or it's an interface, but you're the leader here, you're the one who's it is the slave of your by wisdom. So I guess being a senior surgeon who handles so much of advanced technology, what are the two things I would just quickly want, two qualities that you would see a surgeon should have to build a strong surgical team?
A surgeon should definitely have that inclusive leadership and also the nurturing capacity to build a strong
Wonderful.
team.
Wonderful.
It's very, very important where you have this not an overpowering parent
Absolutely, ma'am.
who
Yes.
lives in your head all the time. That is actually very suffocating. So I never take this concept of a banyan tree because you cannot grow under a banyan tree, though it is
Absolutely.
told as an example for somebody who lives for years. It's a legacy.
Yes.
You're
Yes.
probably a legend, but you're still not left a legacy.
Yes.
A banana tree, a plantain tree is an example which I would take, because you leave something new beginning at the end of yours. So for that, you need a very nurturing climate or an atmosphere where you build this safety net within which they can play around, but you take the onus of responsibility of any mishap, but you still credit them for all the good outcomes. That is a very inclusive and nurturing kind of leadership quality, which enables us to build a stronger team. And it's important to understand no more medicine is a lone wolf practice. I know,
Absolutely, ma'am.
I think it is. It's a mutual trust and respect, and having this nurturing attitude definitely goes a long way in better outcomes for patient and for us as to have more longevity in relatability in practice, because it's a marathon. It's not a sprint where I do this for a short time and I burn out. Keep this doing in and day out as a lone wolf, I'll be burnout. So I think team building is crucial, and I'm sure all the Gen Z will agree with me because they know more about work-life balance now than us. So I'm sure they will be already doing this.
So, ma'am, I'm sure, ma'am, that you are a very good senior to work with, a surgeon to work with, or probably, a dream come surgeon for the staff. My husband is an orthopedic surgeon, and I completely, can relate when he tells me that, my staff was stressed today because I was stressed today. And it makes a lot of difference of how the surgeon is working, because that brings peace to the team, because it's a teamwork when the outcome totally depends not only on the operating surgeon, but also on the staff that is supporting. So I guess that is a very good lesson for a surgeon to carry. Thank you so much, ma'am. So over to you, Kavita, for the next segment.
Thank you, Dr. Ritu. Good afternoon, ma'am. So, moving on to this next segment, it's called Audience Ask, where our audience is asking you certain questions. So, the first one is, do vaginal cups cause urinary incontinence in young women? That's the question.
No. You're talking about the menstrual cups. They do not cause vaginal urinary incontinence, but in patients with already a lax vagina or a prolapse which is existing there, if there are younger patients, do exercise caution and much more be careful when you're taking out the menstrual cup, because it's a suction-like device. When you break the suction, do not use too much force to take it out, because that can make the prolapse a bit more worse. So this is something you need to be aware of.
Okay. And the other one says, what are the best exercises for pelvic floor? If
all
you
the core
suggest your
exercises, yes. So I want to re-emphasize the concept that pelvic floor is not an isolated segment. It's an integral
Overall.
part of your core muscle as well. So if you imagine your core muscle look to be like a cylinder, and the pelvic floor is just a lower extension of the same, and the cylinder is both the abdominal muscle as well as the back muscle. If you have weak back muscles, you tend to have a poor pelvic tilt, and therefore your pelvic floor will be lax. If you're too pendulous abdomen, if you do not have good tone in your lower abdominal muscle, your pelvic floor tends to be lax. And that is when you tend to develop vaginal laxity, urinary incontinence, as well as constipation on the contrary, because your abdominal muscles are not strong enough for the propulsion. So you put unnecessary strain, and that leads to pelvic prolapse. So imagine you tighten up the corset around you. Whatever exercise it takes to do that, that is what we need to be doing. So all your pelvic bridges, butterfly, your reverse curls, your tummy twists, your Russian twists, and cycling crunches are fantastic exercises to tone up your corset. And with it comes your pelvic floor exercises, which you lift and squeeze your pelvic floor. I give a very simple analogy of observing how an elephant opens its mouth and closes. So that should be the action on the pelvic floor. You lift and tighten up the pelvic floor. You relax it and open up the pelvic floor. Just tightening it and releasing it is not pelvic floor exercises. So people should understand this before they start doing it. Otherwise, they'll fatigue their muscles, but with no consequence. So it's very, very important for women to understand that and do regular pelvic floor exercises, which should be done by all women lifelong, at least twice a day in a rep of 10 to 20 every time. So this is the mantra for pelvic floor schedule.
Wow. Amazing, ma'am. I mean, such great details that you've shared about exercises. It really opens our eyes to what we are doing and what we are not doing, actually, which is necessary for day to day.
Which is necessary for all of us. All of
It
us.
is, yes, very true. There's one more question.
And that is one of the reason I did my lifestyle medicine diplomate as well, because 85% of my patient will just get it better by lifestyle medicine interventions.
Right.
But nobody follows.
Correct, correct. Absolutely, ma'am, because the same thing applies for our lifestyle disease called diabetes and heart disease or any other non-communicable disease. It is the lifestyle. So absolutely, ma'am. There's another question that says, what does success mean to you today compared to 20 years ago?
Good question. I think it's success in the eye of the beholder than the rest, to be honest. Previously, I used to think if my peers thought I'm good, I'm good. I really don't think that anymore. If I'm a better version of myself from what I was last minute, I think that is good enough success. For me, it's more satisfaction now rather than success. It's not the numbers, it's not the quantity, it's not anything numerical, it's more the feel.
Absolutely, ma'am. Absolutely true. So let's move on to this next segment. It's called we call it the rapid fire round, which is the pulse of life. So I'm going to ask you a few questions, and if you could answer in 1 or 2 words, like a rapid fire session. So are you ready?
Try me.
Okay. So you're good. Yeah, you're good. Robotic surgery in 1 word.
Precision.
Wow. Okay. Amazing. Precision or patience?
Patience.
All right. Pelvic health awareness, urgent or evolving?
Immediate.
Perfect. A quality every surgeon must develop.
Wisdom.
Wow. Amazing. Technology in medicine, empowering or overwhelming?
Futuristic.
Oh, that's the next. That's the next option, next level. Thank you, ma'am. And women in surgery, 1 word.
Women in surgery. Stalwarts.
And the last one, I promise. Legacy. How would you how would you like to be remembered? Legacy. How would you like to be remembered?
Nurturing, kind, and pleasant.
Superb, ma'am. Thank you so much. I would be passing on to Dr. Lotika for the closing session.
Oh my God, that was a grilling viva. Thank you.
So, Dr. Veera, it's been really amazing being with you. I think we've all thoroughly enjoyed ourselves, as well as there's been so much to learn from you. So I like that you said give to gain. That is, you said the Women's Day initiative that is there, open-minded. And what's very important is the mind behind the robot, because that is something which we must remember. And I'll ask my friends what is their take home from today. Rukaya?
Oh my, this was like a session of Mumbai Indians versus CSK. That was, but I loved it. I loved the camaraderie, and it feels I have known you all for such a long time, and
So
it's
sweet.
beautiful. It's
Yes,
beautiful.
ma'am.
It's been
It's
so
very
wonderful
nice.
to hear you, ma'am. And you are one surgeon who I find you so empathetic. What I love
Yes.
about it when you talked about this nurturing leadership, the inclusive leadership, which I think is the best takeaway for me, that it is the nurturing capacity which is extremely important to build a strong team. And
Hmm.
being a better version of myself than I was a minute before is what is most important. So satisfaction is success. That's
Absolutely.
my takeaways from today's talk. Over to you, Pranj.
And
So for me, ma'am, one thing is we have to start believing before we start. That is the one thing. So we have to
Absolutely.
start believing that this thing is working. Then only I can express or I can convince others or my patient. So that is one thing. And second, which is like very, very, very connected to me, one thing is fatigue body and fatigue mind can't give good outcomes. So, so I was just talking to myself, no, I need to rest on this weekend because it's too much.
Absolutely.
So thank you so much, ma'am, for your inputs. Ritu.
Thank you.
I guess, I definitely want to start saying one thing, ma'am, that you are a clear-cut amalgamation of two paradoxical thoughts. One is, when we see Shiva Parvati as half, two halves. I feel when I see you, it is, strength and then calm. So generally, we say surgeons are very aggressive. So I can see you as that Nari Shakti who's very aggressive when she comes to her work. She's passionate, she's precise, she's expert at her subject, but at the same time she's the nurturing one. She's calm, she's composed, and a beautiful smile. So and what a tonality and what a command on language. Truly, ma'am, we are blessed to be speaking to you today.
Oh,
And
that's very
my
kind of
take
you. Thank you.
and my take home today is definitely the same, that, whatever you do, you ask questions. The more you ask questions, you learn, because at times you never know when the person starts opening up. So, definitely, yes, for me, that's the learning of today, ma'am.
Yes.
Thank you. Thank you.
Dr. Kavita?
So, ma'am,
She's my
really, it
quiz
has been
master.
so amazing and so much fun to hear those answers from you, like right on the spot of this second, and that was amazing the way you answered. And what Dr. Ritu is saying, I totally resonate with what she's saying, that you are strength. You, the way you have spoken and discussed with all of us today, it tells us that when aggression is needed, you are aggressive. But for the treatment and for the betterment of the patient, that is what we all strive to look forward to. So, what I gained from your talk and your discussion today is what you said: more we give, more we gain. That is one aspect of what we do. But more you're inspired, more you can give is what I love about what you said
Absolutely.
today. So, thank you so much. Thank you so much for that.
Yeah.
Pleasure.
Also,
Pleasure.
Dr. Meera, I also agree with you that when you say that doing lifestyle medicine and has changed the perspective in the treatment, the empathy, as well as understanding the basis of the disease, and probably the approach is a different kind of pragmatic way of approaching the patient. And also, I love the way that you described the core, the pelvis. I mean, of course, we all knew it, but the thing is that the way you said it, and I know you are an avid,
Lender.
I know that you are an avid runner.
Yes.
I think you run the marathons
Yes.
also, as well as I do love seeing the designs that you do, the rangoli. I don't know what you call it, the
Yeah, we
kolam,
do. The
kolam. Yeah,
kolam.
yeah. I've
Yes.
seen those designs, and of course the lovely salads and
Wow.
pictures that you do share in the group sometimes. And so it's really been so lovely speaking to you. And we end with the signature, the vibe. So if you can put your hands together, and at the count of
Nice.
3, we say, "Be the vibe." So 3,
Okay.
2, 1. Be the vibe.
Be the
Be the
vibe.
vibe.
Okay.
That's lovely.
Thank you so much. This is
Thank
really
you so much.
Thank
Yeah.
you.
Thank you
Thank
very
you
much.
so much, ma'am.
Bye.
Thank you so
Can
much.
I have
Bye.
the final word?
Yes,
Can I have
madam,
the
of
final
course,
word?
Yes,
of course.
please.
Thank you. Thank you, one and all. Thank you, Dr. Latika, Dr. Ritu, Dr. Pranjali, Dr. Kavita, for such a wonderful time. It's just felt like I'm having coffee with all the titans over
Yes.
here from Mumbai. It was just so
Thank you.
informal, such a lovely chit chat. I didn't feel like an interview at all. And the second thing is, I strongly recommend you girls go and watch Loose Women on BBC. You outdid that show.
Oh,
Do that.
You did
Thank you so
outdid
much.
that show. That's really commendable, because when I used to be in the UK, it used to come around coffee time. I used to sit and
Okay.
watch it while having a cup of coffee. So you girls outdid that show. Well done.
Wow.
Thank you.
Thank you so much.
Thank you so much, ma'am. Thank you so much, ma'am.
Thank you for the lovely opportunity.
Ma'am surely didn't expect this at the start of the vibe.
And we hope to get to see you soon, ma'am. In
Definitely.
real
Yes.
IRL. We hope to get to see you
Me too.
IRL.
Pleasure. Pleasure is mine.
Yeah.
Thank you.
Thank you.
Okay.
Thank you so much,
Bye-bye.
ma'am. Thank you.
Thank
Have
you.
a lovely
Bye.
weekend.
Bye,
weekend.
Yeah,
everyone.
thank you.